Your knee or shoulder has been bothering you for a few weeks. You rush into your primary care doctor's office or perhaps an orthopedic surgeon's office. You request an MRI and one is obtained. Guess what? It's not normal. Is that surprising? Folks, I'm Dr. Howard Lux. I'm an orthopedic surgeon in Westchester County, New York. I've been an orthopedic surgeon for more than 20 years. I've been providing online information for a little over 10 years. We've gotten millions of visitors to our website and our YouTube channel, and it's a real pleasure to be able to help you understand some of the complex topics in healthcare and medicine. So we're going to talk about MRIs today because there's a lot of misinformation about MRI scans. MRIs do not always provide you with an accurate diagnosis. They do not always point out what might require attention. They cause a lot of fear and apprehension in people, and they can thus cause a lot of harm. Now, is it a great technology? It is a wonderful imaging technology. Is it sometimes the best test to obtain? And are there reasons that we should get it? Of course. I'm not saying we shouldn't MRI certain people. I'm saying we clearly should not be performing as many MRIs as we are. Now, you're shaking your head or you're clicking off to another video, but for those of you who are still here, bear me out. Let's go through this. Let's say you're a 50-year-old. You may be active, you may not have been active in your life. What's the chance that you have a cartilage tear in your knee before your knee started hurting you? Well, it's probably about 30-35%. What's the chance that you have a disc bulge in your back? That's about 88%. What's the chance that you have a rotator cuff tear? It's not a small number. So what am I getting at? I'm getting at that a lot of changes that occur on an MRI occur as a normal consequence of aging. What I'm saying is that there are many age-appropriate changes that take place in an MRI. And if you rush into an MRI too soon, you're going to find these changes. And you, or even perhaps your surgeon, might think that the finding on the MRI is the cause of your pain, and further they might suggest an operation for something that was there before your pain started and is not the cause of your pain. Now I've really thoroughly confused you. Let's talk about meniscus tears. All right, 50-year-old runner, cyclist, or walker. You kneel down, you have knee pain. 2 weeks, it's not better. You go to your doctor's office. Let's get an MRI. It shows a complex degenerative tear of the posterior horn of your medial meniscus. That's where most of these tears occur. You head to an orthopedist's office. The orthopedist pushes on the inside of your knee. You say, ouch, and they say you have a meniscus tear, you need an operation. Well, let's go through what the science says. So the research shows that the vast majority of these complex or degenerative meniscus tears do not require surgery, that you're going to get better. Oftentimes, you simply haven't waited long enough. How do you get better, you ask? I have a tear. Yes, you had the tear before the pain started, because sometimes our parts wear out. These are considered, for the most part, age-appropriate changes for many of us. There are many of us who are running, we're running marathons, we're running trail races, we're cycling, we're very active despite having meniscus tears. And more importantly, those tears are not interfering with our ability to exercise, or we're pain-free, or perhaps the pain is mild or quite tolerable. For the majority of you with a degenerative meniscus tear, if you wait 6 to 8 weeks, sometimes up to 3 months, the pain is typically going to subside. Physical therapy can, of course, be of assistance, But now you've had an MRI. Now you know you have a tear of the meniscus. Now you're going to be conscious about going hiking. You're going to worry about going on that vacation to Italy where you have to walk for many miles a day. You're going to worry about kneeling down when you're gardening or playing with your grandchildren or your own kids out on a soccer field. That's the harm that an MRI can do. You now know that something is torn or you feel that something is not right. And for many of you, not all of you, you'll feel that you're simply not whole. And that's a big problem today. Because if we MRI your lower back, as I said before, we have an 88% chance of finding a disc bulge. Now you're told you need an epidural shot, despite the fact that most research shows they're not effective. Or maybe you land in a spine surgeon's office and you're told you need an operation. It's become quite a challenge today. There are some great books out there about something we term overdiagnosis and overtreatment. And to start on the path of understanding overtreatment, where we are prescribed too many medications or we undergo too many procedures, you need to understand the issue of overdiagnosis. So let's back up. You play a little tennis, you do a little gardening, your shoulder starts hurting you. It's not necessarily such a great idea to rush into a physician's office in the first few weeks. And certainly if you're getting better, the trend is your friend. I don't care if you're getting better slowly. I don't care if it's still a little annoying. If it's getting better, it's getting better. We let nature take its course before we need to rush into an MRI. Now, do I need an MRI to accurately diagnose what might be the cause of your pain? Absolutely not. And that has been proven many times over the past decade or so. Your history, or the story that you give us, usually will tell us what the cause of your pain is. Your physical examination and perhaps an x-ray will help define what your diagnosis is. And when we use an MRI, we really should only be using MRI to confirm a diagnosis, not to make one. Because, as I just said, there isn't a person over 40 who's going to have an MRI that says normal. I'm going to say that again. There is not a person over 35 to 40 whose MRI is going to say normal. A keen radiologist, a good radiologist, is always going to find something wrong. So if we just wait it out and wait to see if our pain improves, and again, that time frame is not 2 weeks, we're not 15 anymore. That time frame can be 2 to 3 months. If we give it the amount of time that it needs, then many of us are going to get by without having to have an MRI. Now, I'm not talking about the 45-year-old who slips and falls off a roof and lands on their shoulder and can't move. All right, that's a pretty obvious case where an MRI is going to be useful. I'm not talking about a 40-year-old who continues to play soccer and twists and their knee pops. I'm talking about the average person I see in the office where they don't know what they did. They knelt down, they reached for something. That's not an injury. That's just your body saying, ouch, because of a lifetime of stress. And oftentimes we give the body time and it's going to take care of that pain for you. So should you rush out to your doctor's office and rush into a doctor's office and demand an MRI? In most situations, no. That's not the right way to proceed. We will usually MRI you in time if other treatments such as injections or anti-inflammatories, Tylenol, and physical therapy are not effective. If we're suspicious that something else, like a tumor, might exist, we will MRI you earlier as well. But for the vast majority of you, little time, little exercise, and perhaps some medications and an injection is all you need before your pain subsides and goes away. and you return to being a happy, active camper. I'm Dr. Howard Lux. I hope this little talk on MRIs didn't confuse you too much. This is a very complex topic. I expect to get a bunch of angry comments. It's okay, bring it on. Click subscribe down below so you can get the rest of these videos as soon as I create them. Ciao.